In 2011, the bereavement nurse called me 4 days after my daughter Catherine passed away. She was 12 days old, and during that time, we knew that she was very, very sick. And I knew that the doctors were doing everything they could. But for me, I just felt helpless. So I did the only thing I knew how to do. I made her milk. 80 ounces of it, in fact, over 12 days. And I pumped religiously. Every 4 hours, my phone alarm would go off reminding me that it was time to step into the next room and pump for 45 minutes straight. I didn't know if she would ever really need it, but I did know that I felt like if I didn't do it, I was almost giving up any hope that she may survive. So when the nurse called me that day, 4 days after her passing, with the memory of it still so raw and fresh on my heart, she told me that my milk was taking up their entire freezer and they needed to make space, understandably so. And she needed to know what I wanted to do with the milk. So, not knowing anything about this, I asked her what people normally did in this sort of situation. And that was the first time I ever learned about milk banking. Unfortunately for me, and for many moms like me, we are out there, there was no milk bank in this state to donate our milk to. So I did the only thing I knew to do, and I told her to throw it all away. 18 months later, my son Micah was born, my third child. But at 18 weeks along in my pregnancy, we discovered that Micah was just as sick as Catherine was. And he was presenting in the exact same way. I was literally reliving my worst nightmare. Micah was born when he was 27 weeks, a little over 3 months early. And he was born on Thanksgiving night. He was the sickest baby I had ever seen, and the sickest baby that any of the nurses had ever seen. We were prepared that night by his doctors for the worst. And we were told that there was virtually a slim to impossible chance that he would pull through. But pull through he did, and 9 months later, Micah came home from the neonatal intensive care unit. During those 9 months, a bright light in my many days, going back and forth from home to work to hospital, to work to hospital, back home, were the many conversations I had with the medical practitioners, doctors, nurses, lactation consultants, and even many parents who all agreed about the incredible need that we had for a donor breast milk bank in this community. They all saw, just as much as I did, what an amazing substance that breast milk actually is. And we all agreed that something just had to be done. So due to what I can only explain to you as a serendipitous sequence of events, and the help of an incredible team, and the support of an amazing community, we founded the Mother's Milk Bank of Alabama. And my journey with that ultimately led to my working with the Human Milk Banking Association of North America. During that time, my whole world was breast milk. I ate, drank, not literally, and slept breast milk for about 5 years of my life. And what I learned changed my entire perception of healthcare in America. Because what I discovered was, it isn't the babies born into poverty and health inequities. It's the system that gives birth to those babies due to inequitable access to the best medicine from the start. And I'm not talking about pharmaceuticals. What if I told you that breast milk could actually save your baby's life? And that donor human milk has the potential to fundamentally change the public health landscape of this country? Recently, the World Health Organization released a study where they determined that if every baby that needed human milk had access to it, it would save the lives of 825,000 babies per year. So we're going to get local and remember that the average college football stadium holds about 100,000 people. So we're talking about breast milk having the capability of ultimately saving the lives of 8 full to capacity college football stadiums each year. That is breast milk's effect. Currently, we have a healthcare system that is ripe for change. And at the precipice of that system is the health insurance system. As it stands, states provide Medicaid coverage for their citizens in the most need. Unfortunately, as it also stands, only 8 of these states allow for Medicaid coverage of donor human breast milk. The ones in orange that you see currently have bills on the docket. But as you can see, we are not on that short list. But state by state, people are coming around to the fact that not only is breast milk a lifesaver, but it's a cost saver as well. Every year, half of the babies born in this country are born on Medicaid, meaning that Medicaid covers the cost of prenatal, childbirth, delivery, and postpartum care for mom and baby. That's a lot of babies. And here in Alabama, we have about 1,000 babies who were born each year weighing less than 3 pounds. Statistics show a clear correlation between low birth weight complications and rates of infant mortality. In 2017, the second leading cause of infant mortality in children under the age of 1 was from complications of prematurity and low birth weight. 59 babies died here in 2017 from prematurity complications. These deaths have the potential to be preventable. They don't have to happen, especially considering the cost savings that's included through donor human milk. Take, for instance, some of the most very serious complications in the hospital NICU among premature infants, specifically one with a very long word called necrotizing enterocolitis. You can call it NEC for short, and just think of your neck, and that's how you can remember it. But what it is it is one of the most dangerous causes of neonatal death in the hospital NICU. It can add weeks and weeks and weeks, if not months, to a child's stay in the NICU. It can also add thousands and thousands of dollars to the bottom line. But compare that to infants who are fed donor human milk in the NICU when mom's own milk is not available. Those infants have lower rates of NEC, shorter stays in the NICU, and fewer hospital readmissions, saving on average $50,000 per baby. Why is it that We get blood when we need it, but our babies don't get milk. You know, a favorite blogger of mine likes to often remind her readers, we belong to each other, and I feel like it's time that we act like it. This milk is medicine. It literally saves lives. It changes our children's trajectory. And we have got to get to the point where we can see each other's children as our own, no matter the income. No one ever imagines a traumatic delivery 3 months early. They never imagine having a child weighing less than 1 pound. But imagine that's you. And imagine that you are looking at your own flesh and blood in an incubator, so small that you can hold it in the palm of your hand. And you're told that there's a life-saving medicine, one that could drastically increase your child's chances of survival, but that your baby didn't qualify. And you look across the hall and you see a baby receiving that medicine. Not only receiving it, but thriving. What would you do to get it? Does a child's life have any less value because of an insurance policy? I hope not. My son Micah passed away 3 years ago this month. He was 3.5 years old. In the end, his disease was too aggressive and too severe, despite all of our best efforts. Sometimes even the best medicine isn't enough. But I'm able to go to sleep at night knowing that we did everything in our power to keep him here and to take care of his body while he was here. And it breaks my heart to think that some parents aren't able to lay their heads down with that same assurance. We can address the health inequities among our low-income populations, but it starts at birth. Thank you.